Bismillahirrahmanirrahim and Assalamu alaikum. I welcome you all on behalf of Pakistan Association of Lifestyle Medicine on this webinar, Introduction of Lifestyle Medicine and International Board of Lifestyle Medicine. My name is Dr. Zunaida Basit, and I'm working as Director of IBLM Exam Wing of Pakistan Association of Lifestyle Medicine. I am an alumnus of Islamic International Medical College, and after working for many years in pediatrics and completing my MPhil in histopathology, I moved abroad. Here I came across this emerging specialty of lifestyle medicine in Pakistan, introduced by Dr. Shagufta Feroz. Under her guidance, I became a diplomate in International Board of Lifestyle Medicine and started working with her ever since. So that is all about me. In 1903, Thomas Edison said, "The doctor of future will give no medicine, but will entrust his patient in the care of human frame, in diet and in cause and prevention of disease." Here we are in 2024. We find ourselves in a dead end with burden of chronic illnesses. All we have to offer is pile of medication. But then lifestyle medicine shows up, offering us hope and a brighter future. Let's dip more into this specialty and get more information from our experts. So we have a panel of very respected guests here with us. Assalamu alaikum to all of you. Our first guest is our most beloved Dr. Shagufta Feroz, who is the founding president and current chairperson of Pakistan Association of Lifestyle Medicine. She graduated from Fatma Jinnah Medical University, and later on, along with her practice, she enriched her professional profile by specializing first in family medicine from Pakistan and then in holistic nutrition and integrative medicine from USA. She is the pioneer of lifestyle medicine and the first IBLM diplomat of Pakistan. She has authored a book, Living as Nature Intended, and since 2003, she has been successfully managing the well-being of a variety of patients with her program, SWIPE, Synchronized Wellness Integrative Program for Entrainment. Patients of various ailments completely drug-free based on the principles of lifestyle medicine. She has single-handedly organized Pakistan's first international conference in lifestyle medicine in 2018 and founded Pakistan Association of Lifestyle Medicine. And since 2019, she has got associated with Rifa International University in capacity as the Director of Department of Lifestyle Medicine. She is also an alumnus of Harvard certification, Lifestyle Medicine Tools for Promoting Healthy Change, and was lauded with Change of the Year 2022 award by the Harvard School of Medicine. She is the soul of LM movement in Pakistan and tirelessly working towards a better standing of Pakistan among the members of Global Alliance, as well as in Asia. She is the face of Pakistan among LM leaders in the world. And so here we have with us Dr. Shagufta Feroz. We would request you to introduce lifestyle medicine for our audience, please. And can you please share your journey with LM as a specialty?
I am humbled with the detailed intro which you have given. Lifestyle medicine was actually an accidental discovery by me. I was not looking for lifestyle medicine. I was looking for something which was good for my patients because about 17 years of medical practice, family medicine practice, has made me realize that there is something which we are missing. And the pride which I was carrying about my medical system has started diminishing because gradually I learned that there are so many patients whom I can't help, whom I am not able to face when they come and they ask me that when I am going to be healed completely. So I started looking for something, and nutrition was the first field which I specialized. And it started helping me, my patients, by fixing the foods. So it gave me knowledge about the food. So my journey started in 2005 And my exposure to lifestyle medicine was actually in 2013 when I have gone to ILM, which is Institute of Lifestyle Medicine by Harvard Medical School. And I have done my certification in lifestyle medicine tools from there. So, but initially, when I learned about lifestyle medicine, I have not taken it very seriously because we doctors have a mind and we look for some physical tools also. So I thought, how come this lifestyle will be a medicine for my patients? And I still remember the amount of resistance I have showed to my facilitators who were our who have trained us during that workshop and certification process. But gradually I started learning the depth of those six pillars, which are the base of this foundational medicine, which is lifestyle medicine. And gradually I started implementing those principles in the life of my patients, and definitely the results were very amazing. Results were very rewarding, and actually the results gave me confidence to pursue this lifestyle medicine in depth. And then you know my journey, that how I carried on with the I appeared in the first batch of lifestyle exam, which was in, I remember it was in Tucson. And I just appeared in the exam, and I thought I can appear in that exam without even studying. I was not having even the manual which is now being given to the students, because like all the other doctors, I thought that I know everything about lifestyle medicine. So I have appeared in that exam and I failed because I have not gone through any preparation. But I'm happy that at least I gave a trial to this exam. And later on, you know that I passed this exam in 2019. So this is briefly my introduction about how I landed in lifestyle medicine. But I would like to add a little more about lifestyle medicine. This is the journey of a new doctor who comes to this field, because all of us, we look for tangible factors. We are trained like this, that we look for evidence based tangible factors also. So lifestyle medicine talks about self care. Lifestyle medicine talks about physician burnout. Nobody ever thought about my health. Lifestyle medicine is so concerned about myself. So these were the few very important components which made me realize that this is far more superior to my other specialities. So my message to those who are a bit skeptical and who are still trying to think whether they should go for this specialty or not, my message for them is lifestyle medicine will gradually transform you. It is a transformative medicine. It is not a medicine. It will transform you, inshallah, holistically. And then you will realize what our medical science was lacking when we were studying, or when we were graduated, and how did we have he handled our patients, what we were lacking. So come and join this community of lifestyle medicine practitioners, and I can assure you, you will not be disappointed. Thank you, Zanera.
So next we have our guest, Dr. Muhammad Z Abbas. He is an MD in internal medicine with a dynamic career in healthcare industry in US, Middle East, and Pakistan. Dr. Zia has worked in the field of clinical education, especially in angioplasty, tracheostomy, and temperature management. He was consultant for Johnson & Johnson and Smith Medical for about 22 years, where he was responsible for training and talent development. Dr. Abbas became a student of Dr. Shirgufta Feroz in 2021 and completed his postgraduate certification in lifestyle medicine. He joined her team as a PALM and accompanied her on multiple international forums as representative from Pakistan. He attained his certification in IBLM in 2023 and became the first elected president of Pakistan Association of Lifestyle Medicine. He is also associate country head for Lifestyle Medicine Global Alliance And Dr. Abbas is the managing director and founder of Diligent Enterprise as an organization that specializes in life-saving medical devices and consultancy services. He has recently joined Ministry of Food and Security Research as project coordinator, and he is also a member of task force at the WELMO, World Lifestyle Medical Organization, and is currently practicing internal medicine and working as lifestyle coach in private practice in Islamabad, Pakistan. So, sir, thank you very much for joining us. So, would you please like these all these terms are very overwhelming for us. So, would you like to please explain to us about PALM status and about other sister organizations and how they are working?
Sure. I'm so much blessed to be part of this panel. Almost all of you are my teachers, and I learned lifestyle medicine from you. And I'm constantly learning from all of you. I'm blessed to be part of this journey. Lifestyle medicine is like in Pakistan, globally, lifestyle medicine is not have not flourished to the extent that it should have. So the journey, if we compare countries from country to country, pretty much is in the beginning in most of the countries. It's a startup. If we talk about Asian Society of Lifestyle Medicine, it is still a fish of the small pond, which is just trying to learn how to swim. If we talk about World Lifestyle Medical Organization, WOLMO, it is fairly a new organization which is still trying to put its feet on the ground. I think if I put it in a nutshell, the most experienced is the American College, which appears to me as most organized at the moment, and that's where we got our IBLM examination done from. And Pakistan, we have over, mashallah, over 30 IBLM certified people. And IBLM journey is something that have changed my life. When I joined lifestyle medicine, I tried to do the LMPC, and I learned the concept. I grabbed the basic concept of it. I attempted IBLM, and as Dr. Shagufta was saying, that we as healthcare professionals, we think we are the masters of everything. We know everything. And then I could not make that exam. And then I talked to myself, is this thing for me? And I am so humbled to say that I had so many people motivating me and still telling me, yes, you can do it, you know. And uh, and then I started diving into the deep concepts of this exam. um, I being I was the a victim of non-communicable diseases myself. So when I was in my early time, when I was listening to Professor Maksud, he's trying to guide us how to change our life and how to implement those small changes. I still remember him telling me, "Don't try to think big. Just try to implement it on yourself, and it will give you the impact." So that's where I grabbed it, and I said, if I can make the change within me, that and then I can cascade that change to my family, into the broader circle. So when I started deeply studying about with the IBLM course, I realized that it is not easy. One, it is not easy. Two, it is not for everyone. I would repeat it. It is not for everyone. It is this train is for few who are passionate to bring the change within, and for those who want to change things around them. So it's a very special journey. It's a very special, very special course that will help you transform not yourself, but your loved ones as well. I think this is in a very brief nutshell I could say about LM and IBLM.
Thank you very much, sir. Sir, would you like to tell us about little about PALM, also Pakistan Association of Lifestyle Medicine?
Sure, Sure. So Pakistan Association of Lifestyle Medicine, PALM, was founded by Dr. Shagufta. It is an organization of in the beginning, very few people who were energetic, who wanted to bring the change, who were influencing others. First of all, this I would, as ma'am calls it, it's a holy cause. It's something not very materialistic, yet full. Whatever we do is filled with scientific data that supports us. So it is not something just in the air that we are doing. We just we definitely go through a process where we learn, and then we transform that process. So Palm Association was founded by Dr. Shagufta Feroz, and she is still um, uh, guiding us how to run this in and Palm is registered in Pakistan, SECP. We are trying. We had our first elections conducted here in Pakistan, and now we have an executive board where Dr. Munira is the vice president, and we have a panel of other participants as well. So the objective of PALM is again education. The objective of PALM is, or the vision or the mission of PALM is to expand this good cause that we are all talking about.
Our next panel guest is Dr. Munira Abbasi. She is a medical doctor holding triple board certifications in internal medicine, endocrinology, and lifestyle medicine. Her training was completed at University of Pittsburgh, USA, formerly a clinical assistant professor at the University of Pittsburgh Medical Center in the Division of Diabetes, Endocrinology, and Metabolism. She is the diplomate of American Board of Lifestyle Medicine. She has contributed significantly to the field before bringing her expertise to Islamabad, Pakistan. At the core of her commitment to a personalized healthcare, Dr. Abbasi founded a clinic nurturing our health. Alongside her clinical experience, she serves as adjunct faculty at RIFA Institute of Lifestyle Medicine, where she imparts her knowledge to medical professionals, introducing them to the emerging field of lifestyle medicine. And she is also the vice president of PALM. Dr. Munira, so I would like to ask you about the IBLM exam and what is the difference between ABLM and IBLM and the global standards of lifestyle medicine.
Assalamu alaikum, Zunaira. Thank you, first of all, for having me here. Sort of mesmerized listening to everybody. You know, the presence of people from lifestyle medicine actually gives you so much energy and puts you from your mechanical state of mind to a much more deeper level. So thank you for all of you for being here. So American ABLM stands for American Boards of Lifestyle Medicine, and IBLM is International Boards of Lifestyle Medicine. We just need to understand that both these entities are meant to certify healthcare professionals in the field of lifestyle medicine. So at the core, both are saying that the foundation of health is lifestyle. And in not only in prevention of disease, but also in the treatment and reversal of chronic diseases. They created these two names per se, just because, as Dr. Zia has mentioned, that the original, the most organized way that any country is conducting it is United States right now, and they have a particular board called American Boards of Lifestyle Medicine. For people who have been trained in United States for their medical education and their medical training, they certify them as ABLM. And those who are appearing from international, like globally, they have been given IBLM. I think that just focuses on healthcare landscape in United States versus globally. But overall, the message is the same, the curriculum is the same, exam is more or less the same, and I think the foundation is the same for both.
Thank you, Dr. Munira. So I have another question for you, since you have started your clinic in Pakistan. So LM practices here in Pakistan, how do you find it among the patients? How they are responding to if you offer them lifestyle instead of pills and medicines? What is their response?
I think, like everybody has said, we all started this journey for somebody else and ended up being that as a journey of our own. So I think when I initially started, I was initially in that expert mode. So I was there to, treat people. So as I understood what lifestyle medicine really is, and really, because the foundation of lifestyle medicine is behavioral change. You would recognize, if you ask me one word to describe how people responded, I think it was curiosity and inquisitiveness, and it's still the same. It was just that I was unable to figure that out initially because, as conventionally trained physicians who are very much focused on external, on people, and treating people from outside of themselves, we sometimes feel that people are not interested. They're not going to, really accept this field of lifestyle medicine. But when you start practicing those behaviors yourself, you bring in that compassion and empathy for other people. So at this moment, if you ask me, I feel 90 to 100% of patients who come to me, I see that inquisitiveness, that curiosity, that fear sometimes, that, because this is such a new field. People are not used to talking to their doctors talking to them in a way where we're talking to them about those 6 pillars, where we are also addressing their emotional health, their relationships, their sleep, their diet. I think people do feel heard. It's still a new field. We are learning the ropes. They're learning several things. I have a very small practice, but it's a very satisfying and very rewarding practice. Most of the time for me, it's out of pocket. People are paying out of pocket, but that's something that is very common in Pakistan. So I don't think from that standpoint, we are facing, like in Western countries, we're not facing as big of a dilemma. And I do see people starting off with much hesitation and then getting into this field with much, with open hearts. And it's like every clinical encounter changes both me and my patient. So just to add on, this is a medicine that's healing for the physician as well. So, I'm looking at the patients about their response, and I'm also watching myself changing with the patient. I mean, I can go on this, but I think this is the sufficient, which I can, really, from my heart, I can put out.
Our last panel guest is Brigadier Retired Dr. Maksudul Hass, who is a book in himself. He is the Vice President of Islamic International Medical College, Rifa International University, and he is the alumnus of Dow Medical College, trained in community medicine. He has a rich, varied experience of academics, medical administration, and policy making. He has been teaching community medicine to undergraduate and postgraduate students since 1990. He is also a teaching medical ethics and professionalism to undergraduate and postgraduate students at IAMC. He has authored 15 papers and editor for many important national journals. He is successful IBLM diplomate from the first batch of IBLM organized in Pakistan. Since then, Dr. Maksud has been a voice for lifestyle medicine and been a great support to the Department of Rifa Institute of Lifestyle Medicine.
Thank you very much for giving me the chance to put my perspective on record. Well, lifestyle medicine is something I would go through a long, winding answer, so please bear with me. The knowledge of lifestyle medicine has never been something which was not known to mankind. It was something which Socrates and Plato talked about, that all the 6 pillars had been emphasized on one time or the other. But then we discovered magic pills, and germ theory took us away from the basics of medicine practice. That's where we sort of put our basics on the side and went on the journey. That does not sort of subtract from the contribution of medicine per se in contributing to the well-being of the human beings. We see lifestyle expectancies rising all over the world. But that lifestyle expectancy has then now brought us back to the basics, because now we realize life is about quality that we spend on this planet. quality of time that we spend on this planet that requires us to be socially and economically productive for the human beings. The pandemic of non-communicable diseases has made us realize that the present way the health systems are designed and the way the physicians are practicing their medicine is not going to sustain for a longer period, because as we go into the geriatric society, as we as the population of the world ages, we realize that non-communicable diseases or chronic diseases would take sizable portion. Already American healthcare budget, 75% of the American healthcare budget is spent on uh, treatment of uh, chronic non-communicable diseases or their complications. And the projections are that if just diabetes is taken as an example and projected to 2050, the way we practice now medicine and the way we now handle diabetes, the healthcare systems will become unsustainable. So it's the systems imperative which makes us realize that if we don't change the way we view medicine, we will not be able to handle our patients. Medicine's practice, I've always, because I'm a preventive medicine man, I've always believed in prevention and promotion. Lifestyle medicine has opened up a new perspective. It is not just prevention and promotion, it also reverses chronic disease phenomena. So that the interventions for our patients' well-being should start much before they go to the hospital. That does not subtract from what we do in the hospital. It adds or supports what we do in the hospital. It is the overwhelming of the healthcare system can be prevented by starting our interventions for our patients much earlier than waiting for them to get the complications, get the disease phenomena, and then give them the pill, that magic pill. And incidentally, there is no magic pill to cure any non-communicable chronic disease. You only control chronic symptoms of the patient, and we say we can delay the complications, but we cannot cure the patient. But lifestyle medicine states differently. It says that if practiced properly, it can reverse chronic disease phenomena, and that's what is my perspective. It's the system's imperative. We have to sort of push for it. That's why I'm passionate about it, and I sort of feel we need to really convince people, those skeptics, those both professionals and others, and we are working on it as uh, such a committed team that you all are. Sort of, we will sort of. We the seniors would only like to rejuvenate and take your enthusiasm into channeling it into getting some results for lifestyle medicine and our patients per se. Thank you. That's what I wanted to say.
So regarding the date for the IBLM online exam, which is going to be organized by Pakistan Association of Lifestyle Medicine, the date announced is the 4th October of 2024. And the 4th International Lifestyle Medicine Conference, which is going to be either before the exam or either after the exam, but the date is yet to be announced. Regarding the prerequisites for the exam, there are two categories. One is for lifestyle medicine physicians, and next is the allied health professionals. For LM physicians, you need to have a basic medical degree and a house job. And the requirements for the exam is 30 hours of online non-live CME. 10 hours of in-person CME. CME is the continuous medical education, and one single case study. And the exam is going to be an IBLM, and will be the certification will be called as diplomate of IBLM. For allied health professional, You need to be either master's or PhD, and the prerequisites are same as 30 hours of online non-live CME and 10 hours of in-person CME. This 30 hours of online CME is same for doctors and for allied health professional, and 10 hours of in-person CME, the international conference, when you are going to attend that, it is going to cover that in-person CME 10 hours. And for allied health professional, it will be the same nomenclature, diplomate of IBLM. So this is the curriculum which is available on American Board of Lifestyle Medicine, American College of Lifestyle Medicine website, and the price is $499. So everyone has to make an account and purchase this curriculum, and this is going to complete your 30 CME hours. There is another curriculum also, but usually we prefer this curriculum. Regarding the exam fee for the medical doctors, it's the total is $1,098, and the $499 is for the curriculum, which you need to buy from the American College of Lifestyle Medicine. For allied health professional, the total is $848, and the curriculum you need to buy. It's the same curriculum for all of them. Exam format. It's a 4 hours online exam, which is supervised externally, and there are multiple online multiple choice questions, 150 multiple choice questions for physicians, and 120 multiple questions for professionals, allied health professionals. So this certification validity is for 10 years. And if you, and after 10 years, you have to reappear in the exam. But if you don't want to reappear in the exam, there is the program, they call it Maintenance of Certification, or MOC. And the option is that you, every 5 years, you choose a 30-year approved CME hours curriculum, or any conference or anything. You can attend that, and you can complete that 30 hours within 5 years. And every year you need to purchase 3 articles, read the articles, answer the questions, and submit. So that is a yearly requirement, and 130 CME hour requirement every 5 years. So if you follow the MOC pathway, you don't need to reappear in the exam. Otherwise, after 10 years, the certification to be valid, you have to reappear in the exam. If unfortunately you could not clear the exam, you can reappear in the exam after 12 months, and the fee is $100. For registration guidelines, the registration is opening on 1st February 2024, and there is an early bird discount of $100 on 15th February till 15th February. And deadline for IBLM registration is 31st May. So here on the screen, you can see the contact information and phone number. If you have any query, you can text us, you can send an email to us. So PALM has also been offering a preparatory course every year. It's been last 3 years that they are offering the exam, this course. This course is a crash course for 12 weeks. For this year, this will start in June till August, and the classes are on weekends. And there is an early bird discount if you register before 15th March. So components, they will do a rapid course reviews. There will be sample question practice, guidance with case study, and then finally the mock exam. So that's all about the exam. And I hope this webinar has been informative. And if you have any questions, any queries, you can send us a message. And very soon we'll be announcing a live webinar to answer your question. So thank you very much, all the guests. The discussion has been very fruitful today, and I hope everybody understands what is lifestyle medicine now and what is International Board of Lifestyle Medicine. Thank you very much.
Thank you. Thank you
very much.
Thank you. Allah Hafiz.
Allah Hafiz.